And now we're back with Sunday House Call in our segment, Should I Worry?, in which every week we talk about everything that worries us. One viewer writes, I'm a 43-year-old lifelong distance runner, and he's a lifelong long-distance runner, and I've recently been diagnosed with a torn meniscus. Should I seek physical therapy or surgery, Dr. Samadi? Ouch.
So, yeah, we're talking about Eric Sean over here, a 43-year-old man who is running all the time. So basically, what is meniscus? Meniscus, you have, in our leg, you have tibia and femur. They're the two bones, and in between you have cartilage that basically is a cushion to support your weight. When you're young, like yourself, and you move quickly or you twist, you can tear that cushion, and that's a meniscus tear. As we get older, over 50, 60-year-old, that's osteoarthritis. That's your wear and tear. So depending on your age, depending on the type of tear you may have. Now, the peripheral zone of meniscus has a lot of blood vessels. So if you have a tear in that area, you will have tendency to heal better, meaning that physical therapy may help you. But if it's in the middle of the meniscus where there's no blood flow and it's avascular, there's no blood getting to it, it may take a little longer. This particular study that was published in New England Journal of Medicine looked at about 350 participants. Half of them went for surgery, half went for physical therapy. 6 months after, they realized that both groups are doing really well. So what is the answer if you have meniscus tear? I think the first line is to talk to your doctor. If you have something called clicking, if your knee locks up, if you have a real tear, I think surgery probably is a better choice for you. If you have swelling and pain, which is the most common signs and symptoms of this, physical therapy would be a great way to go. They may give you anti-inflammatory, they may give you corticosteroids, they may give you exercises. If that fails, which in this particular study, 30% of those who did not do well with physical therapy ended up with surgery. And surgery today is arthroscopic. You put the camera,
Mark,
you can remove the chip.
You get these people that come in and you're getting calls middle of the night, I'm sure.
I do, and I learned a lot from this study. So here's the message. If the half that got physical therapy did as well as the half that got surgery, and we're talking about a partial tear to that cushion, that ring-like cushion that is in between the two bones of your knee, half did just as well, and then of the group that didn't get surgery, 30% of them still had symptoms. They went on to get surgery. The message could be, you may want to try physical therapy first. The other message may be, make sure that the doctor involved in this knows what they're doing, because you know what happens out there? A knee jerk, someone like me, an internist like me will say, oh, your knee hurts you? MRI. The MRI shows the meniscal tear. Then I send the patient to an orthopedist. Bang, surgery. And there's some evidence out there that operating unnecessarily may actually increase the risk of more damage to the cartilage and maybe even arthritis, although usually it's a full meniscal tear that leads to arthritis. But there's a question about whether trimming this too much, if it's in the wrong hands. If they take too much of that meniscus, it may decrease the cushion more than you want it to be decreased. I think the message is, if you have the problem, find a surgeon that may not operate right away, that may say, look, physical therapy first. If that's not working, if you're not feeling better, then I can always operate.
Physical therapy can do wonders.
A quick question, because it's sort of related, but what if you're down to bone on bone?
That's a good point.
That's a good point.
What about those injections that are out there now?
It does work for short term, but a lot of times the pain may recur because it's not a permanent solution. Just to jump in for a minute to defend surgeons, there are a lot of great orthopedic surgeons out there that are very ethical, and they do this.
Absolutely.
If once you get to a certain age of osteoarthritis and it's really like breakdown of some of this meniscus, surgery could be a very good option. And again,
but she's asking about bone on bone, which may be a knee replacement.
I understand. It may get also to be a real major surgery, which is a knee replacement. So I think today the surgeries are minimal invasive, few keyhole opening in the knee, and they can see if there's something they can remove or repair. But certainly getting a second opinion is the way to go. If it's not a big deal, it's the beginning of it, physical therapy may help, and then you talk to orthopedic surgeon.
You can get an operation 6 months later. And I agree with you. There's a lot of very reputable surgeons out there that are not going to rush into the OR.
The question is whether there are physical therapies, and again, I think physical therapy is great, but can physical therapy sometimes make it worse if they are not experienced and take a simple problem and make it, into a bigger issue? So talk to your doctor and get a second opinion. That's what I'm...